Community-based residential services, or CBRS, are typically considered healthcare facilities and are subject to the requirements of Chapter 31 of the National Electrical Code, or NEC. These facilities require special attention to detail to ensure the safety and well-being of residents. Several systems are essential for CBRS facilities. Firstly, an automatic fire alarm system is required throughout the building. Secondly, call stations are required in each room or suite that is not supervised by staff. An emergency call system may be used to supplement call stations for staff notification. Emergency lighting is required throughout the building. Regarding accessible design, it is important to follow the requirements of the Americans with Disabilities Act, or ADA, for accessible design. This includes accessible routes and entrances, bathrooms with assistive features, and doorways and hallways with adequate widths. Depending on the specific needs of the residents, additional systems may be required, such as medical gas systems, intercom systems, and security systems. Post appropriate signage throughout the building. This includes fire safety instructions, emergency evacuation routes, and resident information. To comply with code, refer to NEC Chapter 31, which covers electrical requirements for healthcare facilities. Also, refer to NFPA 101, the Life Safety Code, which addresses fire safety requirements for healthcare facilities. Review the ADA Accessibility Guidelines, or ADOG, which provide guidelines for accessible design. Here are some helpful tips. Firstly, coordinate with the facility management to determine specific requirements and resident needs. Secondly, refer to the code books mentioned above for detailed requirements. Thirdly, contact your local building inspector for any additional local requirements. NEC Chapter 31 has several parts. Article 310.1 states that this chapter covers those electrical systems of healthcare facilities that are essential for safe patient care. These are typically installed in hospitals, nursing homes, residential care facilities, and other healthcare facilities. Section 310.10 states that the wiring methods suitable for healthcare facilities are found in Chapters 1 through 4 of the NEC. These include rigid metal conduit, intermediate metal conduit, electrical metallic tubing, rigid polyvinyl chloride conduit, flexible metal conduit, and armored cable. Section 310.15 discusses the grounding requirements for healthcare facilities. It states that all electrical equipment in patient care areas must be grounded to protect patients from electrical shock hazards. This grounding must comply with NEC Article 250. Section 310.20 covers the essential electrical systems in healthcare facilities. These systems are designed to provide power to critical equipment and systems during a power outage. The essential electrical system consists of two or more independent power sources, a transfer switch, and a distribution system. The power sources can be generators, batteries, or uninterruptible power supplies. The transfer switch automatically switches to the alternate power source in the event of a power outage. The distribution system distributes power to the critical equipment and systems. Section 310.30 covers the isolated power systems in healthcare facilities. These systems are designed to reduce the risk of electrical shock in operating rooms and other critical care areas. An isolated power system consists of an isolation transformer, a line isolation monitor, and special wiring. The isolation transformer isolates the electrical system from ground, reducing the potential for electrical shock. The line isolation monitor continuously monitors the isolation of the system and provides an alarm if the isolation is compromised. Special wiring is used to minimize the leakage current in the system. Section 310.40 covers the wiring in patient care areas. It states that all wiring in patient care areas must be installed in a manner that minimizes the risk of electrical shock. This includes using grounded metal conduit, using isolated power systems, and providing ground fault protection. Section 310.50 covers the equipment grounding in patient care areas. It states that all electrical equipment in patient care areas must be grounded to a common grounding point. This grounding point must be connected to the building grounding system. Section 310.60 covers the receptacles in patient care areas. It states that all receptacles in patient care areas must be hospital-grade receptacles. These receptacles are designed to provide a more reliable connection and to reduce the risk of electrical shock. Section 310.70 covers the lighting in patient care areas. It states that all lighting in patient care areas must be designed to provide adequate illumination for patient care. The lighting must also be designed to minimize glare and shadows. Section 310.80 covers the fire alarm systems in healthcare facilities. It states that all healthcare facilities must have a fire alarm system that complies with NFPA 72, the National Fire Alarm and Signaling Code. The fire alarm system must be designed to provide early warning of a fire and to initiate the evacuation of the building. Section 310.16, for example, pertains to allowable ampacities of insulated conductors rated up to and including 2000 volts, with an ambient temperature of 30 degrees Celsius or 86 degrees Fahrenheit. Not more than 3 current-carrying conductors in a raceway or cable or earth directly bearer based on 310.15. B2. And directing factors are found in 310.15. A3. 8, for example, for 14 American wire gauge copper conductor with a temperature rating of 60 degrees Celsius or 140 degrees Fahrenheit, the allowable ampacity is 15 amps. For 12 American wire gauge copper conductor with a temperature rating of 60 degrees Celsius or 140 degrees Fahrenheit, the allowable ampacity is 20 amps. For 10 American wire gauge copper conductor with a temperature rating of 60 degrees Celsius or 140 degrees Fahrenheit, the allowable ampacity is 30 amps. For 14 American wire gauge copper conductor with a temperature rating of 75 degrees Celsius or 167 degrees Fahrenheit, the allowable ampacity is 20 amps. For 12 American wire gauge copper conductor with a temperature rating of 75 degrees Celsius or 167 degrees Fahrenheit, the allowable ampacity is 25 amps. For 10 American wire gauge copper conductor with a temperature rating of 75 degrees Celsius or 167 degrees Fahrenheit, the allowable ampacity is 35 amps. These values are for copper conductors. Aluminum and copper-clad aluminum conductors have different ampacities. Also, the ambient temperature correction factors must be applied if the ambient temperature is other than 30 degrees Celsius or 86 degrees Fahrenheit. For example, if the ambient temperature is higher than 30 degrees Celsius or 86 degrees Fahrenheit, the ampacity of the conductor must be derated. If the ambient temperature is lower than 30 degrees Celsius or 86 degrees Fahrenheit, the ampacity of the conductor can be increased. Always consult the NEC for the most up-to-date information and specific requirements for your installation. NFPA 101 is a comprehensive code that covers a wide range of fire safety requirements for various types of buildings and structures. It addresses things like means of egress, fire protection systems, and other features designed to protect occupants from fire and related hazards. Chapter 18 of NFPA 101 specifically addresses new healthcare occupancies. This chapter provides requirements for the design, construction, and arrangement of new healthcare facilities to ensure a reasonable level of life safety from fire. Some key aspects covered in Chapter 18 include firstly, the arrangement of exits. This covers the number, location, and capacity of exits to allow for the prompt escape of occupants in the event of a fire. Secondly, the construction and compartmentation. This includes requirements for fire resistance ratings of walls, floors, and ceilings to limit the spread of fire and smoke. Thirdly, the fire detection and alarm systems. This includes requirements for the installation and maintenance of fire alarm systems to provide early warning of a fire. Fourthly, the sprinkler systems. This includes requirements for the installation and maintenance of automatic sprinkler systems to suppress or extinguish fires. Fifthly, the smoke control systems. This includes requirements for the installation and maintenance of smoke control systems to limit the spread of smoke. Sixthly, the emergency lighting. This includes requirements for the provision of emergency lighting to ensure that occupants can safely evacuate the building in the event of a power failure. Seventhly, the staff training. This includes requirements for staff training on fire safety procedures, including evacuation plans and the use of fire extinguishers. Eighthly, the hazardous materials. This includes requirements for the storage and handling of hazardous materials to prevent fires and explosions. The ADA Accessibility Guidelines, or DOG, provide detailed specifications for making buildings and facilities accessible to people with disabilities. These guidelines cover a wide range of elements, including accessible routes, entrances, restrooms, and other features. Some specific requirements include, firstly, accessible routes. An accessible route is a continuous unobstructed path connecting all accessible elements and spaces of a building or facility. Accessible routes must have a minimum clear width of 36 inches accepted doors and a maximum slope of 1/12. Secondly, accessible entrances. An accessible entrance is an entrance that complies with the ADOG requirements for accessible routes and entrances. Accessible entrances must have a level landing on both sides of the door, and the door must be easy to open and close. Thirdly, accessible restrooms. An accessible restroom is a restroom that complies with the ADOG requirements for accessible restrooms. Accessible restrooms must have accessible toilets, sinks, and mirrors. Fourthly, accessible parking spaces. Accessible parking spaces must be located close to the accessible entrance and must be clearly marked with the international symbol of accessibility. Fifthly, accessible signage. Accessible signage must be provided to identify accessible features and spaces. Accessible signage must be located in a conspicuous location and must be easy to read. In addition to these specific requirements, the ADOG also includes general requirements for accessibility, such as requirements for clear floor space, reach ranges, and maneuvering clearances. These requirements are designed to ensure that people with disabilities can use buildings and facilities safely and independently. The requirements for healthcare facilities are more stringent than those for other types of buildings. This is because healthcare facilities house people who are often sick or injured and who may have difficulty evacuating in the event of a fire or other emergency. Healthcare facilities must have fire alarm systems, sprinkler systems, and smoke control systems. They must also have emergency lighting and staff training on fire safety procedures. In addition to these fire safety requirements, healthcare facilities must also comply with their DOG. This means that healthcare facilities must have accessible routes, entrances, restrooms, and other features. These requirements help to ensure that people with disabilities can access and use healthcare facilities safely and independently. For example, Section 4.13 of ADOG addresses accessible routes and specifies requirements like minimum clear width, passing spaces, slope, and cross-slope. Section 4.13 addresses accessible toilet rooms and includes specifications for things like clear floor space, grab bars, toilet seat height, and accessible lavatories and mirrors. Section 4.30 provides specifications for detectable warnings, which are tactile surfaces that alert people with vision impairments of hazards such as drop-offs or curb ramps. Section 4.3 addresses accessible ground and floor surfaces, focusing on slip resistance and changes in level to ensure safe mobility for people with disabilities. These are just a few examples, and the ADOG contains many other detailed specifications for various elements of a building or facility. Understanding and implementing these guidelines is essential for creating accessible spaces for everyone.